I'm Dr. Kiran Coelho. I'm head of the Department of Obstetrics and Gynecology at Lilavati Hospital. Birth defects are structural abnormalities which affect the child lifelong after birth, and they cannot be prevented. But for some individuals, there are certain changes that one can make in one's lifestyle, diet, vaccinations, etc., which will help to reduce the incidence of birth defects. Now, birth defects, every 4 minutes someone is being born with a birth defect. Very often these birth defects are genetic, that they are passed on due to defective genes from the parents. But very often birth defects could also be due to environmental changes and also infections which occur during pregnancy. For example, measles, mumps, rubella in the first trimester, toxoplasmosis infection in the first trimester, and exposure to radiation in the first trimester. All these contribute to the development of birth defects. Now, early detection of birth defects in utero is very important. To change the detection of birth defects in utero are very important. And now we have a whole range of tests that we can do for early detection of birth defects. For example, we do an ultrasound at the 7th week for dating. Then the 11th to the 20th week, there is a structural ultrasound which tests the nuchal translucency and the nasal bone, and that together with a blood test called a dual marker test will rule out 99% of birth defects. Then at 20 weeks, we have a 3-dimensional anomaly scan, again where the baby is examined through ultrasound from top to toe and birth defects can be detected. And cardiac birth defects are detected at 24 weeks by another fetal echocardiography. Therefore, by 24 weeks, most of the birth defects which are physical and some of the genetic tests also are all ruled out. But despite that, babies can be formed, can be delivered with birth defects like deafness, blindness, which cannot be made out on the structural scan. Therefore, once the child is born, there should be a proper developed care for all these children who have physical disabilities in later life. Therefore, there are simple instructions that we can give women who are pregnant or who want to be pregnant to prevent birth defects. For example, pre-conceptional, one has to take 400 micrograms of folic acid, and that prevents neural tube defects and spinal deformities. Most important. Be careful with your vaccinations. Everyone should be vaccinated for rubella before they get pregnant to prevent rubella during the first trimester. Vaccinations against chickenpox, measles, all that is important before one gets pregnant. Then prevention of infections like sexually transmitted diseases, toxoplasmosis, all that is also important. And knowledge is always strength. So reading about birth defects, their causes and their treatment is very important for everyone. Thank you.